Pregnancy can cause anxiety. I saw a patient who's been trying to get pregnant for 5 years, and finally she conceived. And the ultrasound showed that she was 10 weeks along. Pregnancy was only about this big. And in the course of the next 20 minutes, she must have asked me 20 or 30 questions. And the questions range from everything to what can she eat, or whether she's going to have a C-section or a vaginal delivery. It's really important to understand this, that pregnancy is a wonderful physiological process. And over 9 months or 280 days, a single cell smaller than a grain of sand grows into a newborn baby. As a doctor, when I'm evaluating a patient, I don't have all the answers for what's going to happen in a week or 2 weeks or 5 weeks or certainly 20 weeks or 30 weeks. I can just decide what I can do for my patient today. I tell my patients this, it's kind of like if you're driving your car and you come to an intersection. If the light's green, you go. If there's red, you stop. What you don't try to do is you don't think, well, what should I do 10 miles down the road? You have to drive down the road to get to that next intersection, and then you decide what you do then based upon whether the light is green or red. As a doctor who takes care of pregnant women, this is how we do it. It's really important to understand that medicine's not an exact science. As obstetricians, we get to witness the miracle of pregnancy. We get to take care of women during the course of the miracle of pregnancy. But we don't have complete knowledge of what's going to happen tomorrow. There are times that many pregnant women go to their obstetrician and you want answers to everything that you're thinking about. Communicate the things that matter to you. You can write your questions down and you can bring them to your doctor or your midwife, and those questions can be reviewed. But typically during the course of the pregnancy, we're evaluating in that moment and we're coming up with a plan for the next time we see you. If your obstetrician pretends that they have all the answers, they're not exactly telling you the truth. The truth is that we're bearing witness to what's going on and we're making the best decision moment by moment. The key thing to make sure that your baby's doing well is once you feel the baby kicking, does your baby kick on a regular basis? As long as your baby's moving well, chances are the pregnancy's doing well.